and welcome to the deep dive. Today, we're taking a close look at a substance that's pretty central to how we understand the body's stress response now.
That's right. But we're sort of stepping back, looking at it through a very specific historical lens.
Exactly. We're diving into adrenalinum, which you probably know as adrenaline or epinephrine. But crucially, our source isn't a modern textbook.
No, definitely not. We're working from excerpts from William Boericke's Homeopathic Materia Medica.
So our mission here is to explore what this particular text from its time and, its specific medical framework tells us about adrenalinum, what it is, how they thought it acted, and how it was used within that context.
Right. So this isn't about today's pharmacology. It's about understanding this substance through the perspective given in the sources you shared with us.
Perfect. So let's unpack it. Based purely on Boericke, what is adrenalinum?
Okay, so the text presents it as an internal secretion. It specifically says from the medulla, that's the inner part of the suprarenal glands.
Which we now call the adrenal glands.
Correct. And interestingly, the text notes that the secretion from the cortex, the outer part, hadn't been isolated yet. That kind of dates it for us.
Ah, okay. A little historical marker right there. And the source describes it as a chemical messenger.
Yes, essential, it says, for the normal activity of the sympathetic nervous system.
Our fight or flight system.
Exactly. And it clarifies that adrenaline's action, wherever it acts, basically mimics what happens when you stimulate the sympathetic nerve endings in that specific area.
So it's like artificially flipping that sympathetic switch.
You could put it that way, yeah. That's the description.
Got it. So how does the source describe this playing out physically? What are the physiological effects it lists?
Well, it starts with local application. If you put a relatively strong solution, say 1 to 1,000, onto a mucous membrane, like the eye, it gives the example of conjunctival installation.
Putting drops in the eye.
Right. The text says it causes prompt but transient ischemia.
Ischemia, meaning reduced blood flow.
Precisely. You'd actually see it blanch, turn white. And this effect, the source says, can last for several hours.
Okay, and the text highlights that its action is prompt, efficient, but also evanescent. It fades.
Yes, and it even gives a reason. Rapid oxidation. It breaks down quickly when exposed to oxygen.
Which presumably is why it was considered relatively safe locally.
That's what the source suggests. Practically harmless unless applied too frequently. It does mention a caution, though.
Oh, what's that?
It mentions reports, specifically in animals, of things like atheroma hardening of the arteries and heart lesions, myocardial damage, if it was used too often.
Okay, so a warning there about repetition, even locally, based on those animal studies cited. What about systemically, when it gets into the whole body?
Systemically, the source says it hits several key areas hard. Arteries, the heart, the suprarenal glands themselves, and the whole vasomotor system.
The system controlling blood vessel diameter.
Yep, and that main action we talked about, stimulating sympathetic endings.
Mm-hmm.
How does that play out systemically, according to the text?
Right, what's the big picture effect?
The primary systemic action described is stimulating those sympathetic endings, especially, it notes, in the splanchnic area.
Splanchnic area. Refresh my memory.
That's basically the network covering the gut. Stomach, intestines, abdominal organs.
Gotcha. So stimulating nerves there causes?
Right. It causes constriction of the peripheral arterioles, the tiny arteries, especially in that abdominal region.
Okay, tightening those small arteries. And the direct result described is?
A resulting rise in blood pressure. The text is quite specific.
Mm-hmm.
This effect is strongest in the stomach and intestines, less so in the uterus and skin.
Mm-hmm.
And quite notably, nil in the brain and lungs.
Wait, nil? No effect on blood vessels in the brain or lungs? That seems counterintuitive, maybe, from a modern view. The source explicitly says that.
Explicitly says nil, yes. That's the observation recorded there. Beyond that main effect, it lists several other systemic things.
Like what? Let's hear them.
Okay, it mentions the slowing of the pulse, which is interesting, right? Because you might expect the opposite.
Yeah, with the sympathetic stimulation.
But the text attributes this slowing to stimulating the vagus nerve up in the brainstem, which does slow the heart.
Ah, okay. A secondary effect, maybe. What else?
The strengthening of the heartbeat.
Mm-hmm.
Increased contractility. It even compares this to digitalis, a known heart drug.
Interesting comparison.
Yeah. Also, increased glandular activity, glycosuria, that's sugar in the urine, hinting at blood sugar effects.
Okay.
Depression of the respiratory center, so potentially slowing breathing. And then these kind of opposite effects on different muscles.
Opposite effects. How so?
It causes contraction in muscles in the eye, uterus, vagina, but relaxation in the muscles of the stomach, intestines, and bladder.
Wow, that's quite a complex picture they were building based on their observations. So if you had to boil it down from this source's perspective, what's the absolute core action of adrenalinum?
Based on Boericke, it really seems to be that potent sympathetic stimulation causing widespread vasoconstriction, especially abdominally, leading to that significant rise in blood pressure. That's the anchor point for its therapeutic uses in this text.
Okay, that makes sense. So, understanding that action, how did the text say it was used therapeutically?
Well, the source is clear. Its main therapeutic value comes directly from that vasoconstriction. Because of that, it's called a powerful and prompt, astringent, and hemostatic.
Astringent meaning tissue tightening, and hemostatic meaning.
Bleeding stopper.
Right. So, primarily used to stop bleeding from small vessels.
Exactly. The text says it's invaluable for checking capillary hemorrhages, those tiny bleeds, from pretty much all parts of the body, but with a key condition
Which is?
where local or direct application is feasible. You have to be able to get it right onto the bleeding spot.
And it lists specific places.
Oh, yeah. Nose, ear, mouth, throat, larynx, stomach, rectum, uterus, bladder. Quite a list.
But it makes a distinction, right? It's not for all types of bleeding.
Crucially, yes. It says it's not for bleeding disorders where the blood itself doesn't clot properly, like, hemophilia in the modern sense. It's for leaky pipes, essentially, not faulty fluid.
Good distinction. And it mentions creating local bloodlessness.
Yes, that ischemia we talked about.
Yeah.
It says you can achieve this locally with impunity, suggesting it was considered safe for short-term use like that.
How is that applied practically?
The text gives examples. Using solutions, maybe 1.10,000 up to 1.1,000, sprayed or applied on cotton swabs. It specifically mentions this for bloodless operations around the eye, nose, throat, and larynx.
Makes sense for surgery in those delicate areas. What about other conditions? Did they suggest it for anything else based on this source?
Yes, quite a few things. Congestion in the sinuses, ethmoid and sphenoid, and hay fever are mentioned.
Hay fever again. Seems like a common use.
It does. The text mentions using a warm spray of adrenaline chloride, 1.5,000 strength. And there's an interesting little homeopathic aside here. It suggests using Hepar sulfur 1X, which is a homeopathic remedy, before the adrenaline spray to stimulate secretions and help drainage. Sort of a two-step approach.
Interesting combination. What else?
It lists Werlhof's disease, which we now call ITP, a platelet disorder for hypodermic use, injected under the skin, 1.1,000 strength.
Okay.
And externally for nerve pain, neuritis, neuralgia, reflex pains, and even things like gout and rheumatism.
How would they use it for nerve pain externally?
Very specifically. As an ointment, using just 1 or 2 minims, tiny drops, the 1.1,000 solution, applied right along the nerve trunk, near where it originates.
Applying it near the nerve's origin, not just where it hurts. That's specific. Were there broader, more systemic suggested uses too?
Yes, the text lists quite a range of conditions where adrenaline was apparently suggested. Now, whether these were common practice or just theoretical possibilities based on its action isn't always clear from this snippet, but they include
Go on.
acute congestion of the lungs, asthma, Graves' disease, and Addison's disease. Those are endocrine disorders.
Right, thyroid and adrenal related.
Arteriosclerosis, chronic aortitis, so artery problems. Angina pectoris, that's heart-related chest pain. Hemophilia is listed again, despite the earlier caution.
That is interesting. Maybe for specific types of bleeding in hemophilia.
Perhaps, or just conflicting reports being included.
Okay.
Also, chlorosis, an old term for a type of anemia hay fever, pops up again. Serum rashes and acute urticaria, which is hives.
That's a really diverse list. Respiratory, cardiac, endocrine, blood, skin, all seemingly tied back somehow to its effects on blood vessels and sympathetic nerves as they understood them.
It really shows how they were trying to map the physiological effects they observed onto a whole spectrum of illnesses.
Which brings us neatly to the most, let's say, unique part of this source, the homeopathic angle. What does Boericke say about using adrenalinum homeopathically?
Right, this is where the perspective really shifts. The text specifically mentions Dr. P. Joseph reporting success treating angina and aortitis, the subacute and chronic kinds.
Okay, treating heart and aorta issues.
But homeopathically, which meant, according to the source, prescribing it per ose by mouth and in an infinitesimal dose.
Infinitesimal, meaning super diluted in homeopathic terms.
Extremely diluted, yes, way beyond the material doses used for stopping bleeding or injections.
So why adrenalinum for angina and aortitis in this homeopathic context? What was the guiding symptom, according to Boericke?
The key, the absolute guiding symptom highlighted, is a sensation of thoracic constriction with anguish. That feeling of chest tightness, pressure, squeezing, combined with real distress.
Okay, chest tightness with anguish. And why does that symptom point to adrenalinum and homeopathy?
Because of the core principle,
Mm.
like cures like. The text states that this specific sensation, along with other symptoms like vertigo, nausea, vomiting, and significantly abdominal pain, these were symptoms that have been produced by the drug itself.
So because adrenalinum, when given in material doses perhaps, could cause chest tightness and anguish, the homeopathic approach uses a highly diluted form to treat similar symptoms in a patient.
That's the principle being applied here, exactly as described in the source. It's based on those symptoms observed from administering the substance itself.
Makes the logic clear within that system. Did the source mention any emergency uses outside of homeopathy?
Yes, briefly. It notes its use in shock or heart failure, particularly during anesthesia.
Why was it used there?
Because, the text says, it causes a very prompt rise in blood pressure by acting on those nerve endings in the blood vessel walls. So that core vasoconstriction mechanism, again, used for resuscitation in this context.
Okay. And finally, the practicalities. What does Boericke list for dosage and any specific cautions?
Dosage-wise, for material use, it gives figures. Hypodermically, under the skin. 1 to 5 minims, again, tiny drops of the 1.1 thousand solution, often diluted further, internally, by mouth. 5 to 30 minims of the 1.1 thousand.